Okay, good evening, everyone, and good morning and good afternoon. Thanks for joining us for the webinar on standards for disposable sanitary pads. Can everyone hear me?
Yes.
Great. Okay. Hi, everyone. This is Tanya Mahajan from Menstrual Health Alliance India, and please feel free to introduce yourselves in the chat box. Thanks for joining us today. And we have a great roundup of experts today to comment on the standards for disposable sanitary pads, very pertinent issue globally.
Thank you very much, Tanya. This is Uleng, and I'll be the moderator for this dialogue today. Good day, good morning, good afternoon, everyone. We are really excited to have you for this first part of the series of webinars, which is focused on standards for menstrual health products. The series will be co-hosted or is co-hosted by the Menstrual Health Alliance of India, by the African Coalition for Menstrual Health Management, MHD, and the Reproductive Health Supplies Coalition. So the 3 webinars in this series will take an in-depth look at the development for standards, and we'll start with the disposable sanitary pads, we'll go to the reusables, and then menstrual cups, respectively, and we'll be looking across the different country settings, looking at Asia, Africa, and global. So the outcomes of from this discussion will be summarized in a document that will be shared. And of course, there are different product categories, but the discussions will be interlinked as we go ahead. So thank you for joining. So as we delve into the issues that we're about to discuss, so more recently, this need for standards has been served by various consumer products, and we've mainly had disposable sanitary pads and tampons. But over the last few years, these products have evolved to offer more increased absorbency, more comfort to users, and different products and materials have been used, including wood pulp, non-woven fibers, super absorbent polymers, additives, and many others. So today we'll cover standardization parameters. We'll look at those. We'll look at what is happening right now in terms of the existing standards. What does the landscape look like in terms of what we have out there, and then we'll wrap it up with some key concerns. But please do feel free to add your points, questions, concerns, or even suggestions in the chat box as we go along. So today's speakers will bring us a global overview as well as perspectives from the different innovative suppliers within the different region. And we'll mainly speak about these topics and in the standards and in the following formats. Tanya Dagan will provide inputs as we go along, and we'll have our key speakers who will be responding to the questions that will field to them, and then questions that will be addressed by the different speakers. So our speakers today, as we indicated, they'll bring us a global overview, and we see them on your screen, as well as the different perspectives to really highlight innovative solutions and issues out there. So we have Tanya Mahajan, who has 10 years of experience in market development of health products and services in low-income settings. Tanya is also the co-founder of the Menstrual Health Alliance India and leads M&E programs on health and gender development solutions. As a proponent of informed choice in menstrual health, Tanya has been engaged in the private sector and mainly in advocacy and the development of menstrual product standards in India in order to enhance the availability of information and choice to the consumers. She's also leading a study in partnership with the University of Liverpool on the acceptability of menstrual cups to increase choices for women in India, and is also an advisor for the Tata Trust program on menstrual health across the 8 states in India. So welcome, Tanya. We also have a second speaker, who is Dr. Michael Mosharash, who works in the Research and Development Division in the who works on R&D Research and Development in the Consumer Division at Johnson & Johnson. He has more than 25 years of experience in product development for the consumer healthcare sector, with expertise in technology transfer and adaptation and environmental sustainability. In his current role as program manager for Johnson & Johnson Africa Innovation Challenge, his focus is on incubating healthcare-related startups in sub-Saharan Africa. Welcome, Michael. Our third speaker is Louise Klickner, who's a 4th-year PhD student in business at Lund University in Sweden. She's conducting qualitative research on the factors that drive destigmatization in the menstrual products field. As part of her research, Louise has gathered extensive qualitative data on standardization of menstrual products within this field from a number of different actor groups, which include government agencies, large producers, consumer organizations, as well as entrepreneurs. Welcome, Louise. Our fourth speaker is Suhani Jalota, who's the founder and CEO of Maina Mahila Foundation, which is a women's health organization based in India. She's currently a Knight Hennessy Scholar pursuing her MBA and PhD in health policy and economics at Stanford University. For the last 8 years, Suhani has been working in urban slum areas and rural communities in the Philippines, South Africa, Thailand, and India. She holds a Bachelor of Science in Economics and Global Health from Duke University, and she's a Forbes Asia Under 30 recipient 2018, Young Achievers Mother Teresa Memorial Awardee 2018, and Queen's Young Leader in 2017. Welcome, Suhani. And our final speaker is Jaydeep Mandal, who's an engineer and has an MBA in Innovations and Entrepreneurship with a Global Innovation Program certificate from GSB Stanford University in the United States. There's more than 12 years of experience in menstrual hygiene, rural innovation, and micro-enterprise development as an entrepreneur, consultant, and advisor with several governments, and several institutions such as the World Bank, United Nations organizations, UKAID, USAID, and international non-governmental organizations like the Aga Khan Foundation. He has been recognized and awarded by several national and international organizations and governments, including the Government of India, the Prime Minister of India, the President of India, for his innovations in entrepreneurship and in the menstrual hygiene sector and related work. So thank you so much to all our speakers. And while I'm here, I'll hand over now to Tanya to take us through the products. Over to you, Tanya. Thank you.
Thanks, Puleng. And we have Puleng, let's say, from the African Coalition for MHM, who's our moderator today. Okay. So today we are talking about standards for disposable menstrual hygiene products. And so it's important to understand what are we looking at here. We are essentially looking at two categories of products, which is disposable sanitary napkins or sanitary pads or sanitary towels, as they are called across different standards in different countries. And we are looking at tampons. The key components for both these products, it's important to understand because that's what the performance and different parameters for standardization really address. So key components of these products are the top cover, the top layer of the product, the absorbent core, which is essentially wood pulp, but also includes other absorbents, including super absorbent polymers for increased absorption and reduced thickness. Then you have the bottom leak-proof barrier, which is typically made of polymeric material. And then fasteners and adhesives to allow for putting the pad on the undergarment, and additives for fragrance and more recently, we have also seen additives for menstrual cramp relief and other things, which again, not sure what the materials are, but these materials are present in products and they are out there in the market today. So what is standardization looking at? What parameters should be looked at for standardization and what objectives do they meet? So some of the things that standardization addresses is, first of all, is that it ensures that the product is identifiable by consumers according to a common definition. So whether it's size or materials, it gives a common definition to the product. And that's true for any consumer product and related standards. It also gives the consumer sufficient information on the packaging to make an informed choice that the product that they are buying procuring is safe for them, is appropriate for them. Then the consumer should have information on appropriate disposal or pooling of used menstrual products, which essentially means disposal, collection, and a segregation and collection of the segregated waste. And then packaging itself should be safe and appropriate for disposal and dispersion. So how are these objectives met through standardization parameters? The key parameters related to these objectives that are included in global standards are, first, physical parameters, which are essentially materials and components of the product. The construction, how do they fit together essentially. The size can be defined either by dimensions or, in the case of menstrual products, by absorbency as well. So light, heavy, medium, whatever the case may be, or by milliliters of menstrual fluid that can be absorbed. In terms of packaging, the standardization parameters define what kind of type and construction for the packaging material should be there. What kind of marking should be there on the packaging, which ensures a safe and appropriate use by consumers. So manufacturing details, date of expiry, what are the raw materials, duration of wear, which is one, of course, linked to absorbency, but also hygiene, because long use can lead to microbial growth and resultant RDIs. Again, what's the method of disposal, especially pertinent in LMIC settings, given that there is lack of waste infrastructure. The next objective that the standardization parameter should meet is the role that the product is supposed to perform, the key performance criteria, which is absorption of menstrual blood and other fluids without leaking. So the key performance parameters related to this are absorbency and retention. So how much menstrual fluid can the product absorb and retain without disintegrating? And then dispersion and moisture content of the absorbent core are some additional parameters. Then, since the product comes in close contact with the skin, the vaginal tissue, and the mucosa, so it should not harm the vaginal flora. It's absolutely essential to maintain, ensure that RTIs do not happen because once the vaginal flora is disturbed, it can lead to growth of harmful microbes. So this is ensured by hygiene or microbiological parameters. One way of ensuring this is to specify the pH of the product. Because vaginal pH is acidic, the product should be as close to that pH as possible. And additional parameters for this are also ensuring that the total bacterial count on the product does not exceed a certain limit. And there's also specific microbiological testing to say that certain bacteria which can cause RDIs or TSS are not present. So these include enterobacteria, say staph, Pseudomonas, Candida. So there are tests to ensure that specific microbes are not present on the product. However, this does not ensure that the products are not introduced later post the product has been opened and is used. Then again, raw materials should be safe. The key criteria that raw materials should be safe, especially since they're coming in close contact with the vaginal tissue. So biocompatibility of materials in terms of toxicity, skin irritation, sensitivity, all of these aspects should be met. And based on US FDA norms, this can be tested through the ISO 10993 benchmarks. Another objective is that the standardization parameters should be vetted through appropriate testing samples because, of course, not every product that's coming out of a facility can be tested. So what's the frequency of testing? What's the sampling for each type of frequency, whether it's one time, whether it's per batch, whether it's every time a raw material is changed. So what's the frequency and sampling of the testing for these parameters? That's also specified in the standard. And yeah, I'll hand over to Puleng to pose some questions to our panelists.
Mm-hmm. Thank you very much, Tanya, for taking us through the parameters. And now I'll go straight into the questions. And I'll start with our first speaker, who's Michael. So I have 3 questions for Michael. The first one is, how would you look at classification for disposable pads and tampons? That's the first question. Because we know that the classification is different across different countries and regions, so that's one. And the second one is, what are the considerations for bioburden related testing? So are testing for both pH and microbial testing required? And the third one is, do all raw materials have proven safety profiles for biocompatibility testing, especially for prolonged contact with vaginal tissue? So over to you, Michael, for the 3 questions. Thanks.
All right, thank you, Puleng, and thank you for the opportunity to speak at this webinar. I mean, first a disclaimer, I'm no subject matter expert in regulatory aspects of feminine hygiene products. The classification, as you know, of feminine hygiene products depends very strongly on the region. So for example, in the US, sanitary napkins and panty liners are regulated by the FDA as medical devices class 1. In Europe, they are classified as consumer products and regulated with their own set of requirements. And in some low and middle income countries, they have product standards that define the product requirements regarding performance, safety, etc. In my opinion, the classification doesn't really matter. What really matters is that the products are safe for the user and meet appropriate performance standards. Ideally, external products like napkins and panty liners are differentiated from internal products since there are very distinct differences in material and use. Tampons being inserted into the body need very different requirements than external products. my recommendation for countries that want to create their own standards is look into the existing regulations either by FDA or by the European Commission or the East African standards and things like that. Now, your question regarding bioburden. Some standards require bioburden testing either on an ongoing basis or at least for registration. This type of testing is pretty sophisticated and it's not easy, especially not for small scale rural producers. You need essentially a microbiological lab. The objective of the bioburden testing is to ensure that the materials and the resulting products are clean and hygienic and don't pose infection risk for the user. I'm not so sure about the purpose of pH testing of the products, but we can talk about this later. Obviously, materials used for sanitary protection products should be clean and hygienic, and they need to be stored and processed in a clean environment. This requires that the bioburden of raw materials is low, that it is stored under the right conditions, and that manufacturing equipment is frequently sanitized. Most feminine hygiene products are not sterile, since they won't be sterile as soon as the package is open. So it doesn't make a lot of sense to aim at making sterile products. But keeping the equipment and the materials clean is important, and also it is very important to train the operators how to work under sanitary conditions. Your third question about the materials, biocompatibility testing, interesting. Yeah, it's a really good question. I'm sure that all large product manufacturers conduct thorough safety assessment for every material that they use. I know that many reputable suppliers of raw materials do the same, but there are so many raw material manufacturers out there. So I think it's the responsibility in the end of the feminine hygiene product manufacturer to ensure that their products are safe for the user. This can either be done through internal assessment of raw materials, which would be difficult for a small operator, or by demanding safety certifications and transparency from the raw material suppliers. But not all suppliers can deliver that. The question about prolonged contact with vaginal tissue and fragrances. Let me start with fragrances. Are fragrances needed for napkins to deliver basic performance? No. But I think you better ask the users if they want scented pads. Menstrual odor is a concern for many women, and they may address this concern.
We lost Michael? Michael? I think we've lost Michael.
Product is made. Can you hear me?
Okay. Now you're back
Yes.
on. We lost you for a while. Yeah. So
I'm
maybe,
sorry.
yes, we lost you just as you were talking about issues of fragrances and preference of the consumers.
Okay. So the issue with fragrances is the. Can you hear me?
Yes. Now we can hear you.
Okay, good. So the issue with fragrances is that you don't need fragrances for the napkin to perform, but consumers very often want it because they want to address the potential risk of menstrual odors. That's specifically important in low and middle income countries where the wearing time of the products tends to be much longer. I mean, the issue there very often is that women don't have the facilities to change the product. So they put the product on in the morning and wear it all day long and then change it again at night, which is, that can be 12 hours or even longer than that. Whereas in the Western world, or the typical recommendation is wear the product 4 to 6, maybe 8 hours or something like that, depending on the product. So the longer the product is worn, the more potential there is for menstrual odor. And, consumers try to address that by using scented pads. If we're talking about contact of vaginal tissue, well, that's that you got to differentiate between tampons and napkins. I mean, napkins are not really in contact with with the vaginal tissue because they're external products, and the natural seal of the labia minora normally limits the exchange between the outside and the inside. I mean, this is very different for tampons, but in my mind, it's more important to get the napkins right because it's much more common, a much more common product in the low and middle income countries to use napkins, because tampons often are culturally not preferred, to put it in those terms. The super absorbent polymers and bleach, I mean, all those products, if they come from a reputable supplier, they're tested. I mean, bleach is not in the product. The bleach is normally used to do two things. For wood pulp, they use the bleach to reduce the lignin, but at the same time, it also whitens the product. Obviously, makes it aesthetically more pleasing, and by bleaching the products, you actually increase the absorbent capacity. So you need less material to get the same level of absorbency. Nowadays, I would say 70% or more than 70% of the products, of the wood pulp products, are bleached. That's called ECF. That's elemental chlorine free. And probably about 20% are totally chlorine free. That means they're using ozone or peroxide or something like that. The reason is you wanna limit the contact to chlorine, because you don't want to have any chlorinated byproducts that could be harmful either to the environment or even to the consumers. I mean, normally you don't find those products. That's why a lot of and one of the reasons for that was that a lot of manufacturers moved to elemental chlorine-free or totally chlorine-free products. Does that answer your question?
Yes, yes. Just one little follow-up on the second question, that we know that the duration of the use of the product is correlated with bioburden growth and increased risk of reproductive tract infections. Have there been any studies to say that the recommended duration of use, which is about 4 to 6 hours, is safe for such products? Are there any studies to establish the safety of the recommended duration of use?
Well, I mean, you don't, if you develop a new product, you don't do a study to determine that. But I mean, first, I'd be really interested in seeing an established correlation between bioburden and the risk of RTIs. I haven't seen a study there, but it would be really interesting to see that. I think that could be really, really helpful. In the developed world, generally the average wearing time is, like, as I said, 4 to 8 hours, and this has been the case for a very long time. So generally speaking, and if you look at adverse effects, that it's a safe, assuming the product is hygienic and made according to the standards, it's a safe time. It's true that microorganisms grow in the soil napkin, and the longer you wear it, the higher you get the bioburden. But as I said, the interface between vagina and napkin is somewhat limited through the natural seal that the labia minora forms, so that the risk of microorganisms on the napkin causing a vaginal infection is somewhat limited. It's not impossible, but it's somewhat limited. It's very different for tampons, obviously, since they're being inserted.
Thank you very much, Michael.
I want to make. Can I make one more comment?
Sure.
What I think, the wearing time, I think, is a really, really important question. Because generally what we find is that the average wearing time in low and middle income countries is much longer. As I said, driven by the lack of safe and sanitary locations to change, but also driven by the cost of the product, right? So what we as manufacturers, and it doesn't matter if you're a large scale manufacturer or if you're a small scale rural manufacturer, what we have to be aware of is that we actually need to make products for low and middle income countries that should have a higher performance standard than typical Western products because of that long wearing time, right? So the challenge is to determine the right standard that benefits most of the women, right? What has the largest impact? Should the products just be better than the homemade solutions, or should they perform as well as they so well that they allow women to fully participate in life, even when they're menstruating? And at the same time, you know, the manufacturing needs to be, the product needs to be affordable, and the manufacturing of the product should be financially sustainable. If it's based on donations or subsidies, long term, that's not really a good option. So it's a very difficult area because you have little disposable income, but you actually, from a consumer behavior, you need high performance products.
Yeah. Great, thank you so much, Michael, and for that additional point, which is really critical. I'll quickly move on to Suhani. 2 questions for Suhani. So Suhani, Mina Mahila has 5 varieties of sanitary pads or products, with some internally manufactured, while some you are procured from external vendors. So what has been your experience in ensuring quality in both these contexts, the internal versus the external procurement? And the second question is that small and medium scale production and different types of distribution models have helped increase access to sanitary pads, especially in low and middle income countries. So in your view and in your work, what are some of the challenges in adhering to standards in these contexts? And maybe if you can just highlight some solutions, protocols, issues around policy support, etc. Thanks. Over to you, Suhani.
Hello. Hi.
Hi,
Am
yes,
I
we
audible?
can hear you.
Yes. Okay,
Yes, you are.
perfect. Thanks so much, Billing, for the question. I think on the first question around the varieties of sanitary napkins and the quality maintenance across the different products, we've really struggled from the very beginning, I think, in understanding what the standards are. So when we were just manufacturing our own products, so 3 of the 5 we are manufacturing ourselves, 2 of which are different types of maternity napkins. And it's still somewhat easier to understand what to do with maternity napkins, because in this case, the buyers are hospitals. And the hospitals themselves would internally test the napkins, and then if 1 or 2 hospitals have sort of stamped it, it becomes that was the sort of quality measure that we were using, or the stamp that we were using for future hospitals. So for maternity, it was slightly clearer. Even then, we did not really have a certification as such from a lab, but the hospitals had themselves just given it to us in writing that this napkin is safe to use, and that we've been using it for X number of years. And that was the only way to sort of get around the fact that the FDA had basically told us you don't need to get any certification for this whatsoever, because this doesn't come under the Drugs and Cosmetics Act in India. And so it's a product that's outside the body. So in fact, you don't need a drug license number. You don't need to be applying for any certification for this at all. And in which case we could just go to the hospital. For sanitary napkins, though, it has been even more challenging, because we don't necessarily understand, is there a certain central laboratory where we can go to with our products and ask them to test it across certain parameters, and then what should we be finding and what the standard for that should look like, and how is this in any way going to be different from the standards that are set for the large scale commercial manufacturers, or should it really just be the same? So I think this is, as Michael was mentioning, I guess it doesn't really matter if you sterilize the product or not. And I think that's what we base a lot of our emphasis on, is no, we have a UV sterilizer at the end, and that's going to solve all the cleanliness problems, but we don't actually know how to really test for whether it's fully sterile or not. And I think that that's still something that we are not clear on. What are the actual standards that we can truly implement on the ground? And for procured materials as well and products from other vendors, these other vendors are large-scale manufacturers who might or might not be adhering to standards. All we know is that they have ISO certification. So that's the Indian from the Indian regulatory authority, I guess, and in which case we have some level of understanding that they're adhering to some protocol, but we still don't exactly know. And we are also asked from some of our buyers whether we can give them raw material certification as well for the different products that we have. And that's also not something that our importers, so we are a very small buyer at the small scale industry. So a lot of we cannot be importing the raw materials ourselves. We're buying it from importers, small quantities. And these importers don't necessarily give us the certifications for the raw materials that they might have themselves. They either don't have it, or this is not something that they're clear about or are mandated to share. So that's again not really a clear regulatory infrastructure around this. So I think overall our struggle here has really been that we don't really know what the standards we should be complying with are. Where should we be going to get things tested? Is there a certain type of a laboratory? Can we get it tested ourselves in local academic institution laboratories? Is that enough? Who are we accountable to? In this case as well, and how do we ensure that the people that we are buying raw materials from or vendors that we might be buying sanitary napkins from are also maintaining their standards as well for us to pass on. So that's getting at the first question. And I think it's sort of getting at the second question as well, in that we've really actually had little understanding from the government standpoint as well, what the policy around this looks like. And I think that MHAI is probably working very hard with the government to help set some of these standards in place. But we currently from the FDA basically told that, you don't really need any certification, so to say, to move forward. I'd be happy to actually just answer any questions on this if you have others.
Thank you very much, Suhani. At this point, I don't have any additional questions, but I think we really highlighted some critical issues, especially around which standards, where to go, who are you accountable to, and how do you ensure that even the suppliers and vendors are also complying and ensuring that the raw materials have gone through the necessary assessment. At this point,
Yes,
I won't have any.
Yeah, sorry, just one more point to add was also the standards for maintaining quality for the pad production facilities. I think that's something that we've also found is unclear, and in fact, I have run around a few different hospital disinfectant companies and been like, what are your standards to sterilize hospitals? Maybe can we use similar standards for our pad production facility, especially because it's a small scale production unit and it is located in a slum community or in multiple slum communities. It's where we have to be particularly cognizant of the hygiene standards. But what are the hygiene standards we should be maintaining in our pad production facility? We don't actually have a clear idea, and maybe there's not also a clear way of tracking it. So maybe there are things that devices that we could be using. Maybe there's just certain standardized things that we could be using, and also encouraging other NGOs or other organizations to be using on the ground. But the pad production facility standards are also not understood very well.
Great, thank you very much, Suhani. We'll get back to this. And then I have one last question before we get back to Tanya. One question for Jaideep. ACAR has a compostable pad. So what are the existing certifications that can be sought, and what are some of the advantages as well as challenges in gaining this additional certification? And yeah, I'm posing this to Jaideep, but if some of the other speakers also have something to contribute after he has come in, please feel free to do so. Over to you, Jaideep.
Hi, thank you, Pulling. Thank you for inviting and to talk about this topic. Actually, it's been there, like we started working on compostable pads back in 2012 when it was not really a matter of discussion anywhere. To talk about this, I firstly wanted to clarify a few things like which many of you are aware of already. So there is a difference between biodegradable and compostable, and there are definitions behind that. So by generally, if you go by the definition, biodegradable means anything which degrades naturally. You can call it as biodegradable, whereas there is no timeline attached to that. So it can happen in over the week time, or it can take 500 years. By the definition, you can kind of call it as biodegradable. And so this is actually kind of misleading term, which has been taking many manufacturers, mostly small, and then who are just selling the product, not manufacturing, getting it from China, not taking advantage of this word, and kind of fooling people across India and many other countries also. Whereas, like, so there are within biodegradable, there are two subsets or three subsets: oxo-degradable, oxy-degradable, and compostable. So oxo-degradable is something which is which says that with oxidation, sunlight, and heat, it breaks down into microplastics. And these microplastics are actually kind of more harmful than normal plastics. And this has been actually banned from entire Europe, and being banned from United States also. But unfortunately, in low-income countries, this is still being promoted. And this microplastics, if it remains in the soil, like animals can eat it and can die. It can also come to our food chain and can harm us. But then, unfortunately, this, because of regulatory reasons, it's still going on. Similarly, there is a the second standard is called compostable, which also have international standards. Like in US, it's called ASTM 6400. In Europe, it is called EN 13432. Like that, in India, government also have come up with a standard which is ISO 17088 2008. So the standard have been developed, and which says that within 90 to 180 days, this material has to disintegrate and become manure in composting conditions. And then whatever is left out is these are not harmful for the environment, for the ecosystem, or for the soil or human body. Now this is something like within compostable also there are variations. I'm not going on that detail, but now this is something which is needed for wherever we claim something which is a green product, or but unfortunately this being misleading in various places, as I'm saying. And this is actually so we actually work with MHAI on the standards part with Government of India. So now the new standard which has come up a few weeks back only as a authorized standard, Indian standard, which is IS 5405 2019. So this has incorporated the ISO standard, which is ISO 17088 as a for any compostable sanitary pads. So this has been a long battle, but then we won that by coming up at least with the standard for Government of India. But unfortunately, this has still not been compulsory for any sanitary pad which is sold in India. So there have been like various companies which are selling this product by the name of biodegradability, or sometimes even compostability. And on the other part, I think like also it is important to understand like things which are there in a sanitary pad, which are generally compostable, which are not. So let's say if I talk about the basic materials of any sanitary pad, the top layer is generally either PP, polypropylene, or polyethylene. The bottom layer is generally polyethylene. The middle layer is generally either wood pulp along with sap and sometime airlaid paper, and there is release paper and gum. So out of that, the most importantly, the two or three things which are not degradable or compostable are the top layer, which is either PE or PP, the back layer, which is generally PE, and also the sap. So these things are like needs to be replaced when you say anything which to be claimed as compostable or degradable. So and there are also another term which has been now promoted is called organic, which is kind of also misleading. They can only one layer, which is the top layer, people are replacing with cotton-based organic materials, and everything remains same, and also using all plastic materials. And this has also been promoted as a green product. So I would say the challenges are more on the first of all, like the regulations, which is just been getting in now in India, but then also implementing it in practically, so that people don't get fooled, and some companies just not take advantage of it, undue advantage, I would say, and misleading people, which is not helping anyone. So they are charging super bomb prices for their products, and so I think it's basically about the awareness among I would say government, standard people, and also the consumers, which is needed for this. Obviously, this should be an option which should be promoted along with the other options which are there. But yeah, there are various challenges before we take the real advantage of compostable products. Thank you.
Thank you so much, JJ, and for highlighting the differences between this, especially the two keywords, biodegradable and compostable, because as you rightly say, there's that tendency to use them interchangeably, yet they do have their specific meanings. And now, yeah, organic, but also for highlighting the fact that for a product to be biodegradable, compostable, it's not about just one piece of material, but the whole product in its totality. So thank you so much. Do any other speakers want to jump in at this point?
Yeah, maybe I have a couple of things to add. Oh, sorry, just dropped my pen.
Okay, Louise.
Is that okay?
Yes.
Right.
Yes.
So I just have a couple of comments. My main point is that we're kind of discussing standardization on a national and regional level at this point. And my main finding about this topic is that I think we should be focusing on creating a global standard instead. I understand that there are differences in need of different types of standards and standards on different levels, depending on the cultures and income levels of countries. And I think one way to address that could be instead to develop a standard that has different levels of compliance. But I think it's important that, or I think it's rather good and beneficial and efficient that people who are engaged in this matter globally get together, because I don't think that enough people are involved in these matters on a more disaggregated level. And we get together and really, or they, and set different types of levels that are applicable anywhere, and respect that people everywhere have a right to safe and good products. And then with regards to the fragrance discussion, I'm totally on board. I do want to just point out that it matters what type of products and how we market them for the stigmatization of menstruation. And one of the reasons why there is a demand for fragrance products is because menstruation is stigmatized, and women and other people who menstruate are afraid that their so-called shameful condition of menstruating will be revealed. And one important, that's an important matter to remember, that the way we place products on the market affects the way women feel about their menstruation and others.
Yeah, hi,
Yes.
this is Jaideep.
Correct.
Actually,
Yes, Jaideep.
yeah, hi. Sorry, actually, I left out one part of the questions which was the waste management part and the disposal of sanitary pads. So if you have time, like I can maybe add a few lines on that.
Okay.
Yeah, sorry. So on the disposal of sanitary pads is actually becoming a big challenge day by day. So I'm not going on the numbers which is there in various countries, which has been talked about in various forums now. But on the practical side of it, like for so the like plastic pads, you know the challenges of disposal of. Generally, it is incinerated, and then because of the lack of infrastructure which are there in low-income countries, there have been again like low-cost. This machines have been promoted where generally it is burned. The pads are burned in very low temperature, which actually creates lots of challenges with the environment. One is obviously the toxic gases which comes out. Sometimes it is also installed in schools, where this gas, toxic gases, when it is burned, becomes a big health issue for the kids also who are in schools. And if it's done in a community level also, same thing is there. Only in few hospitals and large facilities of government have the infrastructure for safely incinerating plastic pads. So that's been a challenge. And then on the other hand, like when it goes to the dumping grounds and all, that creates, like, it takes very long time to dispose it off. So that's the second challenge. On now, if we talk about the green products or compostable products, so there are so it can be disposed of easily by various methods. One is obviously there are certification methods, which is talk about like the composting conditions. So there are industrial composting conditions where there are industrial facilities, which is there in very few in developing countries like India and in Africa and other places. So where it can just go and it get composted. Second option for this is basically where, like, we had also devised one methods while making composting pits, and which is kind of equivalent to somewhat what a compostable industrial composting standard could be made there in smaller pits also, by using things like vermicomposting, lime soda, and kitchen waste and others. We had done it in multiple places and also in few schools, and it has been a positive response we have received till now. Independently, one organizations in Nepal also have tested the same methods with this vermicomposting, and it has worked pretty well. So I would say that if you go for green products, so there is chances where we can compost it in your household, in the community, also at a industrial level. Whereas the other facilities, which is primarily depend on incinerations or dumping, it still becomes a challenge because of first of all lack of knowledge sometime, or sometime being like this small machines being promoted like incinerators, which doesn't have proper standards, and it creates more challenges than anything good they do. Thank you.
Great. Thank you so much for coming back to this point, because it's really a key issue and surfaces in almost all discussions when you talk about products, when you talk about menstruation issues around waste management and disposal. So thank you so much. And of course, there's a lot more to say, and there's a lot more we wanted you to say, but because of time, I'll move through to Tanya to take us through the existing standards that are out there, just to get a feel of what is out there at regional level and within the different countries. So over to Tanya.
Thanks, Puleng, and thanks to all the speakers. I think very pertinent points brought out, which definitely need more deliberation. Okay, so we're just going to present to you just a brief landscape of standards that exist, and this is in no way comprehensive, but just a start to put together what exists, where are the different commonalities and differences, and where is harmonization most required, as Louise pointed out. So for Africa, we've seen that Africa actually has the most number of standards in terms of just the sheer volume if we look at it, and the East African community has its separate standards through the East African Standards Committee for disposable sanitary napkins, which cover construction, performance, hygiene. Ethiopian Standards Agency has one. UNECA and AU, through the African Organization for Standardization, have a separate standard for sanitary towels. The South African Bureau of Standards has one for disposable sanitary pads. The Standards Association of Zimbabwe has one for manufacture of sanitary pads. And most of these cover, like we mentioned, the parameters which are basic performance, construction, hygiene. The South African standard, interestingly, also covers sterility and autoclavability, which actually goes to the discussion of safe handling of menstrual waste, because in LMIC settings, one of the challenges is also, aggregation of menstrual waste in a way that is safe for the waste handlers, and sterility and autoclavability at that level could help address some of the challenges, but definitely more conversation required here. In terms of looking at South Asia, India is somewhere that we have actively been engaging with the Bureau of Indian Standards, and it has recently, the standard has been updated to include hygiene, biocompatibility, and compostability, as Jaideep was mentioning. as additional criteria. Sri Lanka, Pakistan, and Bangladesh also have their own specific standards for sanitary towels, but it was only in Bangladesh that we found that they're mandatory. Nowhere else have we seen. Nepal Bureau of Standards and Metrology, through recent advocacy by partners, they have initiated the process of development of these standards, and more such active pressure is required. Cambodia and Vietnam, we did not find anything, and there are many more countries that we have not covered in this review, but this is just a start, and any information from participants that can be added to this is most welcome. We also we also like to sort of present to you the developed world standards from the developed world, basically US, Japan, and China. Just to point out to say that the US FDA has a pre-market notification requirement for menstrual tampons and pads, which classifies them as non-significant risk medical devices, and have quite extensive criteria for materials performance, hygiene, and toxicology for the products. Japan Pharmaceuticals and Medical Device Agency also has a standard for marketing approval, which also classifies the napkin as quasi-drugs and actually lays out the safety profile of 150 materials that can be used in sanitary napkins, including those that should not come in contact with skin or mucosa, which can be useful as references for development of local regional standards. China Bureau of Standards, China also has standards, but we could not, they are not available in English. So that's again, when you're referencing standards for development, language is also an issue. We could not retrieve anything for Latin America. So any information again on what exists locally, regionally would be very helpful. And
Thank
over
you
to
very
Puleng.
much. Thanks a lot, Tanya. That was really helpful to have that snapshot of what exists out there and some of the details in terms of the parameters that are covered within these standards, because definitely what is within the parameters is also very important. So before I come back to you, I'll jump over to Louise, and just to say, Louise, following this and just seeing some of these standards that are out there in different countries and regions. So what can I say are some of the key differences in these standards across the countries, especially looking at developed countries and lower middle income countries? So I have two questions for you. And the second one is, what are the different development, compliance, and enforcement protocols across low and middle income countries, as well as related gaps? And for the second one, Michael, please feel free to also jump in. But okay, Louise, over to you.
Thank you. Because I was introduced to this webinar at all quite late, I have missed these questions, so I haven't prepared to the extent that I would have wanted to, but I will try my best to respond anyway. Some of the key differences, if I start by some of the most difficult standards to meet, or the highest level standards, I guess we could call them, the MDSAP by Japan and Canada, they're quite high and very difficult to meet, and some of the large global actors are, such as the Swedish Essity, are currently working towards going into Canada. But that's a very long process. And as I've spoken to entrepreneurs, for example, very small companies, they point out that it's important that standards are placed on a level where they're not too rigorous, but also not too low, so that they still obviously do something. Secondly, what I know about the US FDA's standard is that they're often found not to be met. The few studies that are conducted show that there are substances that are prohibited, but that are still found in the products. So the compliance and enforcement protocols there are definitely lacking. With regards to the EU, there are basically almost no specific standards or regulations on menstrual products at all. What the closest we come is with incontinence products and other medical technical products, and it's, I guess, completely voluntary for producers to follow those. And while large producers, I mean, obviously it's very much in their own interest to place safe products on the market, they are very aware but selective in how they follow those standards, the voluntary, or well, obviously all standards are voluntary, most standards are voluntary, but the medical technical ones or medical device standards. Because my focus is mainly Sweden and the EU, I haven't looked at all much on low and middle income countries' standards, but what I do know is there are countries that need standards in order to be able to import menstrual products, such as in Kenya and other East African countries. And what we can see is, obviously because of the hashtag My Always Experience campaign, where Kenyan menstruators were very angry about the about alleged low quality of Always products, especially pads. The standards are either not high enough on a high enough level to ensure that the products are used in a comfortable and non-hazardous way, or they aren't followed properly. So again, there's compliance and enforcement issues. Alternatively, an issue with how the standard is formulated at all. And Michael, please feel free to fill in.
Thank you, Louise.
Yeah, this is Michael.
Michael? Yeah.
Thanks, Louise. Yeah, it's a good assessment. The tricky, well, let's start with the second question with the enforcement. So in some low and middle income countries, you need to meet and prove that you meet the standards with your product before you want to launch in order to get a registration, right? Rwanda is an example. I am not aware that there are demands to consistently supply data about the safety of the products during production. I think it is obviously the responsibility of the manufacturer that if they make product changes that they ensure that the changes do not affect the safety assessment of the product. But the issue definitely is enforcement. So if somebody doesn't want to follow the standards, then it's very difficult to do something about it. And especially if you look at smaller, and I don't want to blame small scale operators, but for them it's sometimes much harder to follow the standards, especially if there are requirements regarding bioburden, because as I said, you need a microbiological lab to do that. The standards in my mind are generally really interesting. So I'm not a big proponent of global standards. I think standards need to be they need to use common sense. So one thing is, obviously you want the best possible products for the consumers, for the women in countries. So you want accessibility and you want affordability. And as I said before, that's sometimes very tricky to deliver. And then the other question is, what is the benchmark? So if you look in the developed world, the benchmarks are commercial products, like like Always or whatever, right? In some regions, the benchmark is a homemade pad, and even a product that would be considered not of high quality is still a significant improvement over a homemade cloth pad. So it's tricky. In the end, I think the important thing is, how can we make standards that we maximize the impact, meaning that we enable the largest number of women to have access to the products to live a normal life during their menstruation.
Great. Okay. Thank you very much, Michael and Louise, for bringing up these really critical issues around standards, around enforcement, and in some countries that we have compulsory standards, whereas in some not at all, not compulsory. But I think key issues that you've also raised are around access to the standards, even where there are compulsory or not, and that's access in terms of cost and reach, but also the implementation, the ability of producers to implement this. As Louise did mention, that some of these are very high and difficult to meet. So these are some of the issues that we are keeping on our radar in terms of moving forward. And at this point, I'll hand over again, go back to Tanya to highlight some of the key concerns around these issues. Tanya?
Thanks, Puleng. And yeah, I think very pertinent, again, points raised in terms of compliance and enforcement, especially in the context that most standards are not mandatory, which actually brings me to some of the key concerns or the key gaps that we've identified. And again, they're in no way comprehensive. From a technical perspective, all of these standards, most of them, at least in the LMIC setting, are limited to the components, the physical parameters and the performance, and few cover hygiene comprehensively, and none really cover material safety, especially with new varieties of additives and claims of cramp relief and things like that, with multiple players coming into the market, importers especially. So considering all of that, material safety is a key concern that really needs to be dealt with. An uncovered compostability, given lack of waste management infrastructure, and the claims of compostability, and the additional concerns raised by Jaideep around false claims of oxo-degradable variants which are coming into the market. Also, clear linkage with waste management systems is missing. Only the South African standard points towards it, but there needs to be a more holistic sort of view of standards of products, because especially in LMIC settings where waste management infrastructure is extremely limited, and there are access is an issue, cost is an issue, availability of infrastructure itself is an issue, and menstrual waste is actually, classification of menstrual waste itself becomes a question mark, whether it's household waste or biomedical waste or household medical waste. How do you classify it? And then again, how do you complete that loop? Most standards, like I said, like everyone's brought up, are not mandatory and difficult to enforce. So is it better to have something which is really high compliance or high specifications but cannot be met by small manufacturers, or something that's more doable and can be complied with by small and medium manufacturers? At an operational level also, there is need for harmonization, like Louise also pointed out, across countries, given that many manufacturers are also operating in multiple geographies. And especially in the case of Africa, there's multiple standards that exist, even in one region. Nomenclature harmonization should also be looked at, because that also has implications for which product are we looking at, offering informed choice, ensuring consumers really understand what they are getting. ISO standards do not exist, and many of the member countries in Latin America and the ones who do not have their own individual standards could refer to an ISO standard or a WHO reference if it did exist. So that's, again, as Louise pointed out, one potential option that could be advocated for. A lot of the standards that exist right now regionally, if you want to access something for reference, they're difficult to locate because of different nomenclatures. Many are available for purchase only. So for small manufacturers, like Suhani mentioned, do not even know where to access standards, do not even know how to comply. There are technical know-how is limited around compliance. Many are available only in local languages. So for reference, for development across a region, the transfer of knowledge gets limited in that sense. Testing of imports is a gray area, like it was also mentioned during the conversation. So these are some of the concerns, but additionally, what was brought out during the conversation by the panelists was also some pertinent points like duration of use. It's a challenge to really understand what's the implication of long use. And the bigger issue, according to me, is actually the lack of evidence around it, and more work needs to be done on that issue. Maternity napkins, again, as Suhani pointed out, is something that really needs a little bit more work, and quality standards for these products are often neglected. Understanding the nuances of green products and implication for standards for those, because it's not a simple disposable or a simple one material product that can be used and throw. Need to think through the decentralized or small scale production and related standards, and countries that have, and most LMIC countries have these models. So we need to think about how to address these. And also what Michael raised towards the end, how can we maximize the impact through the standards that women are able to lead healthy, productive lives, and they're actually enabling rather than limiting. Pulling over to you.
Mm-hmm. Thank you so much, Tanya, for that well put summary, and continuing to highlight some of the gaps that still exist and some of the priorities that we need to continuously put on our radar moving forward. So at this point, I'll hand over to everyone who's on this dialogue, because this is supposed to be a dialogue, so we need to talk. So whether you have any questions to the speakers, or what are some of the important points that you feel were not touched on or may have been left out of this discussion, and maybe to share some of your experiences within your countries or your regions in terms of standards, issues of compliance, issues of access, issues of implementation, accountability, all these issues that have been talked about. So we have one question now, and I'll say that some from our speakers, anyone feel free to address it. So the question is, who should be the developer of these environmental health standards for products and their disposal, in your opinion? So who should develop these environmental health standards for products and their disposal? That's the question that we have.
Can I start?
Sure, Louise.
So I think it's probably obvious. My answer is going to be, I think ISO should develop the standard. We have a process that is going in Sweden. It's been initiated in 2016 by myself and a couple of others to hold the secretariat at an ISO level. It's currently going very slowly, unfortunately. It's difficult to get the large actors on board, and ironically enough, we need them. But if we can't do it, then I think that somebody else should take hold of that process. Like I've argued already, I think it should be on a global level. Thanks.
Thank you, Louise. While we wait for someone else to jump in, I think this is a very interesting question, and I'll link what Louise has just contributed to what Michael said earlier, that yes, I think we have two sides of the coin, that yes, there's a need for global leadership and setting of standards and that provision of policy guidance to say this is the way to go. But going back to a critical issue also raised by Michael around the different contexts and settings and the applicability or suitability of some of the standards and even the products that are out there. So, but for me, it's at different levels. Yes, there's the global level, there's the regional level, but going down to the country level as well, there are different peculiarities and unique issues within the different countries, even within the same region, which brings on the importance of now the countries themselves, led by government, supported by civil society and the private sector, developing country relevant and context specific standards in terms of what is available, what works, what are issues around even affordability of some of the products, the raw materials, what works, while also looking at issues of safety and public health and women's health, and everyone who menstruates, of course, their health, get in them getting the appropriate and health appropriate products. So I think it's at different levels, and definitely compliance and accountability will happen at country level. And this is where I always bring about the important role that is played by civil society within countries and within regions. So thank you very much. Does anyone else want to come in, or we'll check? There are some hands that we see that are up.
If you want to ask a question, you can raise your hand and we'll unmute you. So, Diana Marini, okay, if you want to. Okay.
Oh, hello?
Hi,
Hello,
please
can
go
you hear
ahead.
me? Okay, great.
Yes.
Great discussion, everyone. Yes, so my first question is, if you're trying to develop a solution for increased access to menstrual hygiene products in developing low-income countries, but that are environmentally sustainable. I personally found it very hard to navigate the space, and I appreciate the discussion on, some of the promotion of, biodegradable versus compostable products. What I'm looking for is, do we know as a benchmark the difference of the environmental burden between products in developed countries? Because when we're talking to potential supporters and donors, I'm having trouble getting some more context on, well, what's happening in developed countries and how does our proposed start of the solution compare? So I'm not sure if I'm clear in that question, but that's basically, the waste management issues. It's really difficult to navigate when there's no benchmark even in developed and non-developed. And what's the difference? What's the actual burden going on?
Thank you very much for the question. Michael, is that you?
Yep, this is me.
Yes, please.
So it's a very interesting question. So if you're talking about environmental burden, meaning environmental impact of those products, there are actually life cycle assessments of the various kinds of menstrual products. Those life cycle assessments were done in a European or in a US context. So obviously the whole the waste management, end of life treatment, etc., is reflected for those regions. As far as I know, there are no life cycle assessments for menstrual products in low and middle income countries. It's kind of interesting to see the results. The biggest impact or the biggest environmental impact by sanitary napkins or sanitary or tampons is the consumption of raw materials. It's actually not the waste management. And again, not the waste management in a developed country with a sophisticated waste management treatment of household waste. It's all in consumption of raw materials. So if you compare the various products, the best in sort of the best product, or the product with the least environmental impact is probably a tampon without applicator, like an applicator-free tampon, because the consumption of raw material for that product is the smallest. That's all very, very different if you go into low and middle income countries, because obviously the waste management or the lack of waste management plays a huge role, and impacts the outcome would impact the outcome of a life cycle assessment. But yeah, as far as I know, there are no scientific data or scientific studies on environmental impact in low and middle income countries yet.
Thanks, Michael. Again, very important point. Yeah, some folks have actually been trying to initiate studies, but it's hard to aggregate data from different manufacturers to do a LCA, and also to try and see a comparative LCA for different products. And again, this has been a gap in research in this area, so which requires a little more work. Okay, the next question, Archana, I see you've had your hand up for quite some time. Yeah, go on.
Thanks. Extremely interesting and timely discussion. Thank you so much. I particularly love the comparative standard. Shows us how much work needs to be done. I just wanted to go back to a couple of points Michael touched on and check. Absolutely, you know, the waste disposal is only one end, isn't it? So perhaps when we're initiating this research and these questions, maybe we really should be taking a circular economy approach right from the sourcing of the raw materials and the processes used in the manufacturing, and you know what goes back, and the consumption patterns, etc., of electricity, water, etc., all the way to the waste. And I was just wondering, given that cycle, which is an environmental health cycle, because what's not good for the earth is also not good for us, perhaps would it be interesting to look at a partnership between ISO and WHO, really kind of looking at what could be global standards across a range of products, including cloth, given that we are going back to very basic products, you know, with a rise in incomes and information. Perhaps it's possible to look at simple standards across the range with a combination of actors well really placed to do so. Thank you.
Thanks a lot, Archana. We also had another contribution. And I think, yeah, we can take one more question. We have about 10 minutes to closing. And there's another contribution that we're working on the life cycle assessment of both menstrual pads and commercial pads using LCA software, as we have come across few results which are quite interesting and need more data and research for further analysis. So I think that's another input. I don't know if you want to just share a little bit of that, but definitely the need for more research and analysis, as well as even from the questions that have just been raised, it's really critical, and we definitely acknowledge that. Do you want to just for a minute share that? That's Harinder.
Yeah.
I think we left the discussion.
Okay.
Eventually.
Right. Do we have one more question maybe before we wrap up?
Sure. Anna, I'm unmuting you so you can pose your question. 1 second.
Oh, hi. Hi. Well, my name is Anna. I work for the Swedish Institute for Standards. So I've been working with Louise for a while on this topic. And I just wanted to point out that there indeed is no ISO standard on this specific topic, but there are on many other topics that also works worldwide. So it doesn't always have to be on a level that works for developed countries but do not work for low-income countries. You can find a middle ground. One example is that there's an ISO standard that works quite well for many years, is the one on rubber latex condoms, for example. It works globally, and a lot of international or low-income countries are actually part of the development of that standard as well. So there are examples, and there are many standards that you can pick certain aspects from in order to create a specific standard for menstrual hygiene products. So and also for local standards as well. So there are ways of doing an ISO standard that might not be so scary as well.
Thank you very much, Anna. I don't see any other question or input. I think at this point, okay, yeah. It's just to thank everyone, and a special thanks to us, because a lot of very, very critical and interesting issues have been raised. And so this dialogue has been recorded, and it will be shared with everyone who has registered, including yourselves and people who didn't manage to join us this afternoon or this morning, and can be shared. So it will be disseminated shortly, but once again, a proper brief will also be compiled from these webinars. And as you are aware, this is part of a series of webinars, and the next one, dialogues. Let me rephrase, not really webinars, but dialogues, web dialogues. So the next one will be in March, and we'll be looking at reusables. And then in April, we'll be looking at the cups, as we know that there are a lot of discussions happening around cups, including issues of acceptability and so on. But the need for standards is really critical, because we promote choices and we promote variety and options, and people should be able to access the different products, but there needs to be that oversight and monitoring of the quality of these products, hence the need for standards. So we'll hopefully meet all of you again in March and in April. And before I hand over to Tanya to officially close, I'd like to also recognize some of our colleagues who've been doing a lot of work in the background, and that's Ina, Veronique, Nancy, and the team. Thank you so much, and I'll hand over to Tanya at this point. Thanks, everyone.
Thank you, Puleng. Thank you to all our speakers for joining us today and providing great insights. I hope this is not just one conversation, but the initiation of some collaborative efforts in this space for global and regional advocacy. We hope to see you all at the next webinar, which will be in March, on the reusable cloth pads. Thank you so much. Bye-bye.
Thank you. Bye, everyone.
Thank you for Bolerate and Tanya for the excellent, and all the speakers.
Great.
Thank you.
Thank you.